Hello, I'm Sophie Scott. Welcome to Healthwatch. There are treatments for the symptoms but no cure for dementia. Now Australian researchers are closer to slowing down and even reversing frontal lobe dementia. They've found a mutant gene that responds to psychiatric drugs already on the market. Rebecca Barrett reports.
Barbara Mallett's late husband helped identify the gene that could now lead to an effective treatment.
He would be very thrilled to know that he had played a great part in this.
John Mallett had hereditary frontal lobe dementia along with his siblings and extended family members. It was their DNA that helped find the gene responsible for abnormal proteins in the brains of people with the disease.
What we see in these cells is that the abnormal protein clumps, and that's what makes the nerve cells die.
Laboratory tests have found that drugs already used to treat schizophrenia can stop the proteins building up.
Compared to the normal process of making a discovery trying to lead to a treatment, this has just collapsed the process down hugely.
But there's still a long way to go. The drugs need to be tested on mice to see if they get the same results. Work on getting the clinical trials ready is also underway. Researchers are now hopeful that with more testing they might be able to reverse the damage already done, or at least slow the progression of the disease with an effective treatment that could be available within 3 to 5 years.
It is very encouraging that this drug could potentially alter the course of the disease rather than just treating the symptoms itself.
That's significant for 22-year-old Liz Mallett, who has a 50% chance of getting frontal lobe dementia.
I don't want to think about it at the moment, but at some time in the future, when they've got more research done, I might decide to get tested for it.
But for now, that's not something she's worrying about.
There's been a major shake-up of the healthcare system. Patients getting primary care from nurse practitioners or midwives will now receive Medicare rebates. It's the first time such rebates have been paid to health workers other than doctors. As a nurse practitioner, Leanne Bowes has been able to treat patients for a range of minor illnesses, but now for the first time patients will be able to claim Medicare rebates for her services.
It's a significant step and certainly a very important one.
The rebates will range from $8 to almost $50 for longer consultations. Nurses say patients are the winners.
They want that choice. They want to be able to make the decision whether they see a nurse practitioner or whether they see a GP. And for people who live in areas where there aren't many GPs, they just want access to healthcare.
Women using eligible midwives will also be able to claim their services back from Medicare for care during pregnancy, labour and postnatal care.
Today is day one. We look forward to the growing number of midwives and nurse practitioners who will make use of these benefits.
Under the changes, nurse practitioners will be able to prescribe medications on the pharmaceutical benefits scheme.
It's a real acknowledgement that nurse practitioners are providing safe and effective care.
Most doctors support nurse practitioners and midwives working as part of a team, but some are concerned about extending the Medicare rebates.
Fee-for-service mechanisms of funding through a Medicare rebate don't promote the very teamwork that we desperately need now for the treatment of chronic diseases.
The changes come into effect from today. And scientists from Sweden and Canada have found that a short course of antibiotics can affect normal gut bacteria for up to 2 years after treatment. The research suggests that the long-term effects of antibiotics are more significant than previously thought, and it could lead to new strains of antibiotic-resistant bacteria. That's all for Healthwatch. See you next time.